Black women in the United States experience unacceptably poor maternal health outcomes, including disproportionately high rates of death related to pregnancy or childbirth. Both societal health system factors contribute to high rates of poor health outcomes and maternal mortality for Black women, who are more likely to experience barriers to obtaining quality care and often face racial discrimination throughout their lives. Black women are typically paid just 63 cents for every dollar paid to white, non-Hispanic men. These lost wages mean Black women and their families have less money to support themselves and their families, and may have to choose between essential resources like housing, childcare, food, and healthcare.
The environment is like another character in every Black woman's story, right? You don't get Black women or in our stories without thinking about the environments that we are raised in, that we live in, that we oftentimes that are the main sort of reasons that we are experiencing some of the disparities in healthcare and things of that nature that we're experiencing. So you think about many of the stories that we tackle are stories of home, right? And in most Black families, Black women are at the center. We're at the core of home. We are building the environment that we live in, right? We decide what products we use and how we're going to care for the babies and things of that nature. A lot of products that have been pumped into our communities, that have been marketed and promoted to Black women are not healthy for us. So we start out, even when we look at the makeup that we use or the things that we put into our hair, we're trying to do the best that we can, right? But there sometimes is a miss there with what we put into and onto our bodies, right? We live in communities that are deeply impacted by things like gentrification. We look at some of our communities that are what some people call food deserts. I'll just say that we are oftentimes living in spaces that don't nurture what we need to grow and sustain ourselves.
Black women are 3 times more likely to have fibroids than white women, and the fibroids occur at younger ages and grow more quickly for Black women. Black women display signs of preeclampsia earlier in pregnancy than white women. This condition, which involves high blood pressure during pregnancy, can lead to severe complications including death if improperly treated.
I think that when you are looking at the mortality for a pregnant woman, that is just a snapshot of a woman's life. That's 10 months of a woman's life. But that woman came in with her pre-existing conditions. And so you really need to zoom out. It is really short-sighted to think that we can address the mortality or morbidity of a woman during pregnancy without addressing that woman's total health. And so when you're looking at ways to address this, it's going to have to be a comprehensive plan in place to do this. How are we going to make sure that these women are healthy or at their best prior to pregnancy and during pregnancy? How are we going to increase their access to care? You know, if a woman comes and I see her during the pregnancy, maximize her outcomes at that time, she delivers the baby, and then I don't see her again until her next pregnancy, there's a huge number of things that can happen in that time. If she has gained weight, if she had any conditions that really needed to be managed after the pregnancy that were not managed, medications, simple things, refills of medications. If she had mild hypertension in pregnancy that then persisted outside of pregnancy, was she continued on those medications? Were we maximizing the management for those things? Her weight. Obviously, pregnancy does lead to weight gain, but then even after pregnancy, if she is on a trajectory of gaining weight, you're going to increase her morbidity. And so when you're looking at trying to minimize the mortality for a woman, I think you really have to address her total health. When you're looking during pregnancy, a great relationship with your provider is going to be helpful as well. Making sure that there's trust. I think that open communication. We are here to serve in the medical community, and so we're wanting to provide good care for patients. And so being able to have an open dialogue and conversation, I think fosters that, such that if something is not quite right with a patient, she feels different, she feels unwell, she's not even able to say exactly how she feels, but she feels comfortable enough to at least call attention to it, that is helpful for us. when we are treating and taking care of patients, we are looking at tangible indicators like blood pressure and labs, but then also when we're talking to patients about how they feel, that's very helpful. So having that conversation and that trust is going to be beneficial as well, I think, to improving women's outcomes.